Pregnancy is a natural process. So if it's not happening or if it's not sticking, something is missing. After having a family member go through infertility and experiencing a miscarriage myself, I realized how little support and education women have around infertility. I want to change that. I'm Dr. Jane Levesque. I'm a naturopathic doctor and a natural fertility expert. Tune in every Tuesday at 9 a.m. for insightful case studies, expert interviews, and practical tips on how you can optimize fertility naturally. If you've been struggling with infertility, pregnancy loss, women's health issues, or you just want to be proactive and prepare yourself for the next big chapter in your life, this show is for you. This week, I connected with Dr. Randy Michaux. He's a chiropractic doctor, a health coach, and the owner of Total Body Wellness Clinic. We had a great conversation on how to approach complex cases, including infertility, and how mental and emotional health is at the root of healing chronic health issues. Thanks so much for being here, Dr. Randy. Tell us who you are, what you do, who you serve.
Thanks for having me. It's awesome to be on.
Mhm.
So I work in Meridian, Idaho at the Total Body Wellness Center clinic. I used to work with Dr. Todd Watts, who still is here often, but it was awesome. He sold me the clinic a year and a little bit ago, and that was amazing. So I serve people that are really battling chronic illness, and I find that people that seem to be attracted to me are those that have had more of an emotional trauma that is underlying that maybe they don't recognize, right? They see all the symptoms, all the challenges that come with that. But when we start diving into trauma, emotion, the thoughts, the questions that they often ask themselves, the wording, the language they use to describe themselves,
Yep.
very quickly you pick up on, oh, there's a lot to unpack here. There's a lot of negative programming, negative language, and that is so detrimental in one's health. And I think maybe that resonates with me because a lot of that was my journey, and a
Yep.
lot of that was what I experienced and had no idea sometimes what I was even saying or the impact that had on my own health until I finally did. And so I so appreciate the journey of a soul and the beauty of what we experience, and knowing that life is a gift, that all these things, whether good, bad, ugly, have happened for us. And how do we get to the point where we see it as such? Because it's not that way going through it, right? No one wants
No.
to. I don't want to experience things that I've experienced again,
Yep.
but I wouldn't trade them. And they've made me who I am. And so now I honor those. I'm grateful for them. But that wasn't always the case.
Yep. It's beautiful that you say that. So for those of you who don't know who Dr. Todd Watts is, CEO founder of Cellcore with Dr. J. Davidson, and I actually am working with Dr. Nick, who is in your clinic
Yep.
as well. And one of the reasons for me was to really grasp the products. I knew that they worked, but they have this energetic feel to them as well, where this is different. This isn't just a supplement that I'm picking up on the shelf. And getting to know you guys, like you've been a speaker at Cellcore at the Eco event as well, and watching how you guys approach it, I was just like, I gotta learn about this. I gotta listen to this. I gotta figure out what it is, because it seems to be working differently than everything else that I've done before. And I
Yeah.
do think it's because it gets down to the frequencies, but also the connection that you make with your patients, that mental and emotional.
100%. And you don't find that often. And that's what I see
There's a
lacking
huge
is
need
that,
for it. It's a huge need for it.
yeah, people want connection. We're so disconnected, and people need connection. They need to feel loved. They need to feel appreciated. And do I do a perfect job of that? No, I'm human and I screw up. But my heart is so with people, and I love people, and I love learning about them. And then it's very quickly you start to hear language patterns and words, and it's like, why'd you say that word? Why'd you say that sentence? What do you mean? I don't know what I even said. Like, here's what you said. Why'd you say that? I have no idea. And then we got to unpack that. And so, but I will say with these products in my own, if I can, just where I've come from, I'll share that briefly. From the age of 13 That's the first time. I tried fasting the first time when I was like 13. It was for church purposes. It wasn't for any detoxing, that biohacking. No, it was for
Sure. Yeah.
church. We fast monthly. And I had a wicked headache. And I was mad at my parents for making me fast. I was mad at everybody. And I just thought that was, well, that's me. That's just how it is. Of course I don't feel good. I'm not eating. But then that persisted. And that one headache turned into some headaches every month. And then as I progressed in age, until I progressed in age, I was still super young, right? But I
Sure.
remember my first year in college, I was getting migraines. And these are full on migraines where I've got to go into a dark room. I've got to disappear. Light,
Yeah.
sound is just going to set me off. And I would actually hope that I would vomit because it seemed like that would get rid of the migraine and then I would be wiped out for the rest of the day. So I started going to the chiropractor and it kind of helped, but not really.
Yep.
And went to chiropractic school for different purposes. It wasn't even that, right? I just thought migraines, everyone has them. Someone told me that everyone has headaches. It's just what you have. You just have to deal with it. But they got worse. And I remember at one point I was having them weekly and it so disrupted life because now here I am, like, can't interact with family that day, schoolwork, chiropractic school. Like, I can't do any of it. I just have to be in a dark room and don't talk to me. And that was so challenging. And I really felt like as I began to understand chiropractic, I'm like, oh, this is going to be the key. This is going to be the thing that helps change it. And then I get into practice, which is a whole nother emotional challenge, trauma on some levels.
Yeah.
And the migraines intensified. And there was a lot of hypoglycemia with that as well. And I had changed my diet through chiropractic school, learning about things because I did a lot of work with nutrition. And I mean, Dr. Josh Axe was in my class. Like, I sat across the aisle from him, if anyone knows who he is. And he was huge into nutrition. And we learned a lot from each other, learned a lot from one of our professors. But still, like, these migraines persisted. And now I'm, a year into practice and finding that I have to close my office few times a month. And I may be like with a patient, finish the patient. All I can do to finish working on that patient before I run out of the door and vomit. Like, it was that bad. My face, my patient, are you okay? Are you feeling okay? And I'm faking it like, yeah, I'm okay. I think, excuse me. And I'm
Yeah.
gone.
And
Like, I'm
just,
out the door. Thank goodness it went to like this field. And then I began to recognize, like, there is something
yep.
worse going on. There's a different condition. For a while, I was really purposefully, probably, or ignorantly blind, thinking I can just chiropractic my way out of this. When my neck gets good enough, then these will go away. And it wasn't until we went to a naturopath, and this was now 2008, 9.
Yep.
So still well before like the whole biohacking thing took off and all that.
Yep.
And I remember she doing some bioenergetic medicine with me, some biofeedback. And she's like, you have every marker that's leading to colon cancer. I'm like, I'm 33 years old. She's like, you don't have colon cancer, but every marker is going in that direction. And then
Mm.
coincidentally, my dad, a few years later, died of colon cancer. His dad died of colon cancer. My dad's sister died of, I think it was colon cancer or liver cancer. So it's in my history. Does that mean I'm going to get it? No, but if I live that lifestyle, I would
For sure.
continue.
Yep.
And so we drastically, and so she shared all that, but what she shared, and I wish I would have appreciated this more. You'd think I learned my lesson at this point. I wish I would have listened to her more. She talked about the drainage pathway
Mm.
and shared with me, your liver is a disaster. She says that you're not processing anything. Your body can't detox. Your lymphatic system is blocked up. You're definitely not digesting anything. And I could verify that because I saw it all in my stool. And she put me on a program. This is before Cellcore was birthed. There was no Cellcore at the time.
Yeah.
Um, and she put me on a pretty much a liquid diet that I would say probably saved my life and what she did. A lot of different tinctures, a lot of different frequency. And I look back now and I think the frequency that she gave me was monumental in some of these changes, but that wasn't enough. I still didn't learn my lesson. And I began to change definitely, right? I had lost 30 pounds. I'm about 6'4". I weigh about 190. So I had lost 30, 35 pounds. And over the next year and a half, I gained all that muscle and weight back, which was fantastic. Loved it. Continued to do a lot of the nutritional things and still didn't feel called to go that direction. Was still very focused. They even asked, they're like, hey, do you want to come learn how to do this? Come Fridays, we'll teach you how to do this. And I'm like, no, I've got my chiropractic practice. This is what I do, right? I look back now, I'm like, dude, that would have been amazing. Anyway, then my
Your soul
dad,
wasn't ready for it then.
it wasn't there. I was not in the place with humility,
Yeah.
compassion, non-judgment that I needed to be in this place.
Yeah.
It wasn't until my dad died and I had to forgive self, forgive him, others for a lot of perceived stuff. And that took me several years. And then met Dr. Watts through my sister. And he's like, you should come work with me. And then I did 6 years ago almost. And that brings me to now. And that was another life-changing event. But it's so interesting how God continues to bring things into our life
Yeah.
until we're ready. And it's like, what I love about that is that he'll wait for us and he'll keep presenting it. It's my opportunity to accept it or not. There's no forcing, but I love this. I have this belief that he kept presenting this to me. And finally, when I was ready in the right place, it was fully embracing that. And now, I love working with people and taking them through chronic illness, but really seeing them make the breakthrough of, I have value.
Mm-hmm.
I am a being of light and love, and I am worthy of all things. And I think
Mm-hmm.
that's beauty. When people start to reach that point, I think that's when healing seems to take off in different ways.
For sure. Yeah. What was the breaking point? Because you said after you did with the naturopath and you gave the muscle back and all of that, but you still had the headaches? Did you still have the migraine?
No, I didn't. I no longer had the health challenges. Like it took me a good year and a half to really digest food, no more headaches. Like I haven't had a migraine now since I was 34. I'm 47 now, maybe 34, 35, somewhere around there. I haven't had no more signs of hypoglycemia. That's all
Yep.
gone. So I continued on like on myself, working on my own health and nutrition and inflammation, but really never presented that to other people because I was so focused on chiropractic where I was there.
Mm,
And there were
yeah.
elements that I would bring in. It was more as information only, not just, hey, you want to transform your life? Like, here's what you need to do. It wasn't until, again, my dad died that then it really hit me. Wow, I am missing a massive component of health, thinking that I'm going to get people well with chiropractic only. I so believe that it's needed, chiropractic, but there's
Totally.
this
Yep.
other side of detox, drainage, cleaning out the body and allowing it to thrive that I was kind of blind to, and then began to dive into that with people like Dr. Dan Pompa, and then I met Todd, and it was like, wow, this is a whole new world that I get to tap into. So, yeah.
Yeah. Well, I always try to describe it that there is the physical, mental, and emotional, and health is really in the middle. And sometimes it's our physical health that brings us to deal with our mental and emotional. And sometimes it's mental and emotional. But, if you have B12 deficiency or parasites, you still have to get rid of the parasites. And I believe that it will, when the body is strong, when there is that physical resiliency, then it's easier to go through some of the mental and emotional stuff that we have to go through and break our beliefs or maybe relive some of our traumas. I'd love to know kind of how you approach your cases and what your beliefs around, and even like, how do you take your cases on through from, hey, I'm really sick, to this being of light and joy.
Yeah. So one of the things that happened to me early on, and this was after my dad, no, this was before my dad passed away, a lot of resentment, a lot of shame. And there were some things that were happening. And I remember a patient had shared with me the body code, emotion code. Thought it was ridiculous. Honestly, thought it was like, that's so hokey. But I'm sitting at my desk, just feeling this weight of what needed to happen. And I had prayed. I'd been doing a lot of things. And I swear this chart of emotions like just appeared on my desk. I didn't see it. It was probably already there, but I'm like, what the heck? I might as well do this. It's a tool. I know how to muscle test myself now because I've done a little bit of things. And this is going to get to your question. So I do this work, this emotion code. I release all these energies. They all resonated. I'm like, yep, feel that one, that one, that one. And then I finished and I had this massive weight. I mean, it was palpable. I swear I felt like I was 20 pounds lighter, even though I wouldn't want to be 20 pounds lighter.
Yeah.
And my first thought was, oh my gosh, this is the most amazing feeling ever. Thank you, God. And then my next thought was, I have to be proficient in this so I can teach this and help
Yep.
other people through this stuff. And so I began to do that with patients. Now, as I work with people, words matter. And I listen very intently to the words they use regarding their condition. Do they own the condition? Is it a condition, or is it, this is me, my Lyme disease, my depression, my
My infertility.
parasite, my infertility, right? All these things, do they own it, or is it just a condition? And for most people, they own the disease. Like, this is mine. This is my label. It defines me. I have my support groups with it. Don't take away my label, because then where's my support group? I'm no longer accepted.
Mhm.
And as I listen to those things, I begin to ask questions to see, where are you coming from? Where did these perspectives come from? Where did this transition? And I find that for many, it's very young, that they
Mhm.
just pick up. I mean, we're a sponge from like age 0 to 7, where everything is real. And so words matter, thoughts, intents, looks, stares, like whatever we do with our kids. And I'm not free of this either. I've got a 3-year-old right now that I'm like, man, you got to watch what you say. But so as I listen to that, I start to craft their plan. And part of it is this emotional mindset. And it's more than mindset. It's really like heart set, soul set, this aspect of it where, hey, we're going to be training on this.
Mhm.
And I'll take people through different exercises to help them gain awareness to the language they're even using, right? Oftentimes I'll ask people, what are the questions that you ask yourself? And often what I hear is, why can't I get well? How am I going to do this? How long is it going to last? Why did this happen to me? Which are questions that you can't answer, right? Because it did. Sorry. I mean, it's there.
Yep.
And so we'll start to work on better questions, how to ask different questions that are more empowering. But those questions are then going to direct our mind to focus on different things. Now I can, instead of focusing on, if I ask a question like, how am I ever going to get through this? Well, then what I find is our brain finds everything that happened in our lifetime that didn't work. And it all is like magnified. Well, when you were 3 years old or in 3rd grade and you tried this, it failed. And then in 7th grade, this failed. And you tried this and it failed. So why even bother? And it's like, I don't want to be in that space. Whereas if we ask different questions, we're going to get better answers and we'll direct our mind to be more empowering. So that's a huge component of what I
Yep.
do with people. And then at the same time, it's, okay, what pathways are blocked? How is your lymphatic system doing? What is your liver doing? Are you even pooping, right? Are you even able to eliminate? And speaking to your audience, with men specifically, mean, the prostate is a repository of toxicity, right? It's so easy for it to accumulate toxin, which then is going to impact, a lot of
Sperm
things,
quality,
insemination and
DNA,
fertility,
fragmentation. Yeah.
yeah, all that. And then are you mouth breathing or nose breathing? Because that's going to play a huge difference, right? Um, and so all those things are factored in, and then we start to craft that plan to build that for them. And then we're kind of off. And now it's a process of what do we need to adapt, change, modify? How do we build upon that? But the one piece that is always there is this mental, emotional component of working through perceived or real traumas. Same thing, whether it happened or not. If it's perception, it's real. And
Yep.
I used to think that was the dumbest thing. I'm like, but it didn't really happen. I'm like, doesn't matter. If you believe that it happened or that's how you perceived it, then that's how your body's interpreting that. So unlocking those drainage pathways. And what I find so interesting is that I go back and think about what Dr. Dory, who I'm sure she's no longer alive, she was like 77 when I, worked with her. I find myself often thinking back to, wow, she was the first person that explained drainage. And I wish I had that initial drawing. I don't think I even kept it. I think, oh, I don't need this. And I'm
Yeah.
like, man, I wish I had that now just as a, you know, something on the computer to say, wow, this was like 2008. There was somebody that was speaking this. And as I was exposed to Cellcore and the roadmap to health, I mean, that changed so many things too, because prior to that, it was, hey, let's use glutathione, let's build up the cell, and now let's like pound this stuff, man. Let's just go at it. Parasites, heavy metals, toxins, and no, that didn't work so well. And it didn't work
Yep.
so well for the people I worked with until I started incorporating
Yep.
the real roadmap, which is energy, drainage, and then working into more of the parasite, toxin, metals.
Yeah. And, I always try to, because my own healing journey, it wasn't until the naturopath who got to know me, like I remember that question when he was just like a clinic supervisor, because I was just going through school, it was year one, a lot of IBS, anxiety that caused more of the IBS, resistance to weight loss resistance. And he just walked in and he was like, okay, where are you frustrated? Where are you stuck? And I didn't I knew an answer to that immediately. It was such a simple question, but it was
Mhm.
like at that time, I'm like, I can't find a partner. And he was like, okay, let's talk about that. Cause it's not, and I remember because it was a clinic supervisor and there was the students in there and the students were like, what? Like, I didn't know that that was a thing for her because nobody ever asked.
Right.
Right. And then of course we looked at the lab work. He looked at data. It wasn't just the mental and emotional component. It was really important. And that opened the door from, it's like a can of worms. Now I'm like, okay, I guess I need counseling. I guess I need therapy. I guess I need to actually look deeper into this because I always thought that men were pigs and that's why I can't attract, it was them, not me.
Yeah.
But then I had this roommate who had no issues finding fantastic boyfriends. And then she would dump them and then find another one a month later and then dump them and find another one later. Obviously, different issue.
Right.
But that's what got me thinking like, wait a minute, I can't even find one. Maybe it's something about me. And that was my first experience of
Mhm.
really digging, understanding. And, my IBS went away within, yeah, I still had to change my diet, but now the
Yeah.
supplements worked. You know what I mean?
Yeah. Yeah.
Because
Yeah.
there's times where you're just like and I'll invite my patients after to once they're conceived and they're, in the green zone, even they've already had their babies to just like give insight as to what was different. And one of my patients was like, there was a point where you said there's no amount of tatka that I could give you to go through what you need to go through. And the tatka I find really helps because it will
Right.
activate and it will
Yep.
stir things up. But you actually have to admit that there is an energetic and an emotional block, a mental block that you just have to, it's here.
Yeah.
It's hard to explain it.
It is hard to explain it. And I find, I was working with someone, I'll just say I was working with someone and I asked, like, how would it be for you to just sit and just be still? Don't worry about what you have to do later. Just sit. And she's like, oh, I kind of feel anxious with that, like a little nauseous. Like, wow,
It makes me nauseous just the thought of that.
just the thought of it. And I'm like, okay, we have a lot to. She's like, I don't do that.
Mhm.
And I've had other patients before that tell me the same thing. They're like, no, I don't go there. Like, well, the place you're afraid to go is what's limiting your ability to heal. So until you're ready to go there, again, we can give you TUDCA and all the good stuff, but
The
you
pair
have to be
one,
willing to go.
there's no.
And I told this one person, like, I can't do it for you. I can't do the breathing. I can't do this for you. You have to be willing to just sit and be and trust the breath, trust that your creator is going to support you through that. And I said, and we even got to the point where I'm like, how about we just set a timer? 2 minutes. Like, you set a timer for 2 minutes, turn off your phone, no distractions. You won't have any calls, and just 2 minutes, and just sit and be, and then breathe. And we gave her, I gave her specific ways of breathing to do. And I say, when the timer goes off, you're done.
Mhm.
And she was like, you know what? I can get on board with that. I can do that.
Yeah, totally.
And I didn't. Sometimes I'm like, well, how about 3? I didn't even do that. I'm like, no, we're not even going 3. 2 is good. And so we'll see how she does with that this month. Whereas other people, I've talked about that as well. And and often it's more moms than dads,
Mhm.
because moms are rushing. Moms are doing everything. They're kind of the
For
quarterback
sure.
of the house, right?
Yeah.
Eyes are on everything. And if there's any challenge, mom's taking care of it. It's just kind of that nature of, if there's a problem, I'm going to take care of it. Husband comes home, and I am a guy. Men are great. We have our weaknesses, our strengths. It's easy just to, no, I'll get to it.
Mhm.
Whereas, and I've done that before where, sorry, I digress a little bit, but like, hey, will you vacuum the carpet? Yeah, I will. And I fully intend to, but if I don't do it like within 2 minutes, it's like, okay, I said I was going to do it, but it wasn't fast enough. And nothing,
That's
anyway.
it. There's memes about that on the internet for a reason, you know?
Yes, there are. And there are. But going back to that point where it is harder, I think, for women to be still. But that need is massive.
Mhm.
And the willingness to sit with things, and to, whether you're breathing into it, whether it's through exercise, whether it's through, whatever thing, I think that's so important, that we allow ourselves to just be.
Mhm.
And I think gratitude, journaling can all put us in a state where but but I guess I say all that because that has to be part of the healing journey.
Yeah.
It's, we talk about toxicity as being a major cause of why parasites are a major problem, right? Of why bacteria and viruses change, right? These things that are commensal in us, that we have in our body naturally, and now all of a sudden they're not.
Yeah, like the
It's
H. pylori pleomorphing and
right. And
mhm.
even perhaps Lyme, right?
Mhm.
That
Yes.
you can have people go out, 10 people have Lyme disease, one of them has symptoms. The rest are like, yeah, I'm good. I'm fine. And what is it that shifts that? I think that toxins are a massive component, but I think even before that, there's this emotional aspect, and that's not for everybody, but I do believe that many have that emotional aspect that kind of set their body up for this chronic nature of health.
Yeah, where you're kind of almost I mean, I wanna talk a little bit about the label that you've said. So in my space, very much the label of infertility, and when I'm interviewing my patients to see if I'm gonna work with them, I kinda see how flexible they are with that label, because sometimes it's you don't actually want to get pregnant anymore. It is become who you are, that you are infertile, and that this is how you get love and attention from the world and your family. And that's a really hard label to break, you know?
Bet.
So I'd love
Yeah.
to kinda hear your experience of what you do, because Lyme disease and I mean, I'll get chronically ill people too, their goal is just to get pregnant, where you're almost just waiting for the next shoe to drop that you then will have to fix, right? And that's what you're talking about is it doesn't, no amount of TUDCA or HMAT binder or chelation or whatever it is that you're doing, at some point, it's just actually detrimental to the body.
Yeah. I think two of the most important words that we use, and then the word after that is actually the most important, is I am,
Mm-hmm.
right? The word that follows that, and we actually on our intake forms, maybe they didn't have them, maybe this wasn't there when you like started working with Dr. Nick, but it's there now. And the question is, finish the phrase life is. People are. Because I want to see global beliefs of what they have. And many times life is hard, a grind, challenging, unfair. And it's like, okay, that's their view of life.
Sure.
And then people are, you know, deceiving, mean, out to get you. It's like, dude, wow, what a perception of life. Even this Sunday school class that I teach, 13-year-olds. When I first did this with them, I was shocked at the answers. I was thinking, hey, these kids, like they're 12 years old, 13, most of them 12, like it's going to be life is fun. No, life is hard, grind, challenging, mean,
Wow.
unfair. I'm like, dude, already from the age of 12. And so I think awareness is critical. We're not even aware often of what we're even saying.
Yep.
And then when you repeat back to someone, what, no, I didn't. I didn't say that. Actually you did.
It's
And
on the form.
right, it's on the
You
form.
typed it out, actually.
Or just even talking to people, right? Why did you use that word? Well, I didn't say that. No, actually you did say that. And again, it's coming back to like owning the condition, my whatever, my depression, my illness. And I don't know if there's one way to get out of that, but I think first having the awareness to recognize what the pattern is.
Mm-hmm.
And then the second step is, I think, honoring God within us, knowing that and this takes time, right? This isn't like a quick thing. Yeah, he's there. No, I think this is something that we really have to dive into to believe that, hey, God created you in a way that you have a purpose. You have a divine purpose and you have talents and goals. But what happens is through chronic illness or through infertility, it's like that takes over. Instead of the goals or talents that they once experienced or had, it's like, yeah, those things that's really not important. Like this is the big thing. And those goals they're not good. I was there, right? Not so much with infertility, but wanting what other people had. Like what I
Sure.
have is not good enough. I
Mm-hmm.
need this other thing. And I would always look at, man, I would use this phrase all the time. And I didn't realize what I was saying. If I just had that, if I just was more like that person, and when I finally recognized what I was saying, and my coach, Dr. Fred, was like, do you realize every time you say that, you're telling yourself, I'm not enough and I will
Mm.
never be enough. And I was like, no, I'm not. And he's like, yeah, actually you are. And then
Yeah.
then the awareness came of, oh, wow, you're right. And it was through a process of, he's like, here, let's repeat a few things. And he'd have me repeat. And then what did I feel like with that thing? I'm like, I don't like that. That's like, that's no good. And, and then I would work on other things. I started doing affirmations, and then I got to rituals and then incantations where I was using body movement and, changing in my tone and voice and actually like bringing that in, where these incantations were things like, I am powerful, I am loved, I am love. And that all kind of went into this honoring God within me, that he created me to be more than what I see now. And others have seen that, but and others, we do see that in other people. They themselves don't see it. And so if we can learn first to honor, I think, God within ourselves, and then comes forgiveness. And that was the second step for me, was accepting forgiveness for myself, for the things that I had done, for the ways that I had judged so many people,
Mm-hmm.
and all a reflection of my own insecurity and weakness, and then really accept that love for them too, no matter where they were, place, who they were, how they lived, to just really understand what it meant to be non-judgmental. I don't have to agree,
Yep.
but I can still love them. And as I did those things, my language began to change around myself. And I think that that is often what it takes for other people, that everyone may say, well, I already believe in God, or I believe in a creator, or whatever, the universe. But it's like, but is that in you? Is it there? And are you honoring those gifts and talents that you have, that
Hmm.
you've been given? And do you even know what they are anymore? And then I think that as people begin to experience that, then it's easier to start to shed the label, or to even see themselves as, wow, I have value. Like, I'm
Hmm.
not a burden to my family. What is my family gaining from this? I feel like a burden, right?
Hmm.
But am I really? And what lessons has my family learned? What have I learned from this? Where is the good in this? Is there any good that I've seen from it? And I think that's where gratitude comes. And I feel that gratitude is this massive bridge that goes from fear and anxiety, and it takes us to peace, right? And without that, we'll stay in that fear and anxiety. So I think those are those first steps to beginning to shed the label, that we have to honor God, honor the talents that He's blessed us with, given us, then begin to forgive ourselves and others. And it's so interesting in Matthew, right? One of the first commandments. What are the two great commandments? Love God, and then love others as yourself. You have to love yourself. Have to. And so one of the things that I do here every day, I've got a mirror right in front of me, and I love the word magnificent. I heard this from a mentor who said, my definition of magnificent is to magnify the essence that God has blessed me with. And so I look in the mirror and I put my finger on my chest and I say, I'm magnificent. Yes. Right. And it changes my state. It changes my frequency, and that
Yep.
energy matters. Right. And I've asked other people to do that, and they're like, I can't do that. I'm like, it's three words. I am magnificent. You can't. They're like, no, you don't. I'm like, no, I understand what you're saying.
I know
I
why
know
you
you can
can't do
say
it,
the
but you need to do
words.
it. Yeah.
I'm like, well, what can you say to begin to recognize your worth again? And as some people, I use love, like, appreciate. Oh, I can do that one, or I can do like, but I'm not there for love yet. But I think those little things are are huge.
Yeah. Well, I was going to ask you, what do you feel like? What causes for us to identify so hard with our label? Is it what we hear from the age of 0 to 7? Is it the conventional system that tells us, oh, you have this and this is who you are? Where do you think that label, that attachment to a label comes from?
I think it's a combination of the two. I don't think it's one or the other. I mean, clearly from that age of 0 to 7, there's so much that's programmed in, and where we begin to learn fear and, oh, I shouldn't do that. That person said that was dumb. So does that mean I'm dumb? And this is not being thought of logically. This is just being internalized.
Totally. Yeah.
And then, you see a kid that will be out, skipping and chasing butterflies. And then someone says, that's so dumb. Like, that's just childish. Grow up. And, oh, well, okay, maybe I shouldn't do that. Right. And so we like die a little. And then I think that as we get older, we die a little more, because then it's, well, what are other people going to think of me if I say this, act this way, you know, have these beliefs? And then when we get into the medical system and you're told by someone in authority, well, this is just the way it is. This is your condition.
Yeah, for sure.
It's like, oh, and if you're told that once, maybe you're like, no, I reject that. But when people are told that over and over,
For
and
sure. It
that
just
you're
becomes part of you.
powerless, right? You have no power over this unless you take a medication. You have no power over this unless it takes the power away from the person. And again, we just like die a little. And there are those people that just outright reject that. No, I don't agree with that. I don't believe that. And they automatically go a different direction. but the vast majority
For sure.
don't.
Yep.
And it just becomes the narrative. And then their brain, and this is crazy again how the brain works, is that as we hear those messages and start to believe it, then our brain is going to create legs for that table. And then it's going to create roots. And those things go deep into the ground until it's like part of the wiring. And,
Yeah.
and so it's both. And the more that people are, I'll say, prone to just believe what they're told by a physician, the more that's going to be ingrained. And I remember someone telling me, and maybe this was from Tony Robbins, maybe someone else, but they're like, dude, no one's coming to save you. You got to figure this out for yourself. And clearly, I don't know everything, clearly, but it's like, no, I have to take responsibility for my
Yep.
stuff and learn as much as I can about what I'm experiencing to
And
then
it
be
doesn't
able to.
mean so nobody's going to help you. It doesn't mean nobody's
Right,
going to
right, right,
help
right. No,
you.
no, no.
Yeah.
We still need help, but it's like,
You
no,
have to take
I've
the
got to be
responsibility
proactive
to
here.
find the help. Yeah.
Yeah, I've got to be proactive in this. I can't, you can't be a passenger when it comes to your own health, because then who's driving? Is it Western medicine, which is going to drive you towards death, or is it, your intuition? What is being like breathed into your soul daily, and you may be resisting that, but there are answers there. And I think that when you walk into someone's office, you feel that like either coldness, or you feel like, wow, this is so inviting, like this is the right place.
Yep.
And maybe you don't understand what's being said, and that could be part practitioner with communication, but I think that that intuition and feeling is so critical to. And people can be saying all the right stuff, but still, if there's not a connection, it's like, it, how much am I going to get out of this?
For sure.
So,
Any insight? Because obviously I deal with a lot of pregnant, pregnancies
yeah.
and preconception of kind of passing on some of our generational emotional trauma, preconception, and then, through pregnancy. Because personally, it's a belief of this is why I'm such an advocate for like figure out your shit before you start having kids because you're just going to pass it on,
Mhm.
and whether it's physical health or mental and emotional, you just have to figure it out. Like you should just do that anyways because you deserve that. If I take two exactly the same pregnancies in terms of the same diet, the same lifestyle, exercise, all that jazz, but one person is extremely anxious and overthinks everything versus another is, just joyous, humble, content, grateful. Is that going to be a different baby? And it's like the answer, it's like, yeah, of course it's going to be a different baby because that has a different
Absolutely.
impact on the physiology as well. But just even how the baby is going to turn out. I'd love to hear your insights on that if you have any.
Yeah, I'll use my personal experience. So this is probably still raw for my wife that we're working. I mean, she's still working through this, so am I. So we have a 3-year-old. He'll be
Mhm.
4 actually next Wednesday,
Hmm.
and he was not expected. Right? We had 4. Again, I'm 47. I'll be 48 this year. So will my wife. So minus 4 years, and we're 44, 43 years old. Right? Our oldest is right now 11. So there's a gap. No, sorry.
The youngest
Our
is 11, so
our
11 and
second
4,
youngest
yeah.
is 11, and now we got a 3-year-old. Right? Our oldest is actually 20, almost 22. It's a huge span there. We were done, and then we weren't. And my wife had already had 3 C-sections. So now here's another C-section that's coming. Plus, having a baby in your 40s is very different than having a baby in your 30s or
Mhm.
20s.
20s,
So
yeah, for sure.
recovery is going to be way slower. And there was a lot of resentment, both for me and for baby. And not that, and I don't judge her for that. She looks back and she's like, gosh, I was such in a bad place. And it's true. I mean, we were both not in a great place. And now as we see our 3-year-old, almost 4-year-old, man, so much of that carries over. Oh, and so then on top of that, he was born the beginning of COVID, and he had to be on a ventilator because he stopped breathing at 7 minutes old. So to me, that's like, I don't want to be here, right? He was breathing fine. And then 7 minutes hit and everything just stopped. Like the nurses, the respiratory therapy doctor and all, they were walking out the door literally. And then like, wait, something's going on. What just happened? And he turned blue.
Yep.
And now he's rushed to, first the little NICU there, then had to be rushed to a different hospital. And now, because of COVID restrictions, both of us could not be there with him at the same time. And we couldn't hold him or touch him for like 4 days. So we had no contact, no physical contact. We could see him, couldn't touch him, and then had to leave. And
I think people really underestimate how traumatic that is.
like
just to get over that. Yeah. I like when I gave birth to my first, because my labor was long, it's like they had 4 steps. They didn't put her on me the moment that she was born because they wanted to make sure.
Yeah.
And even that and it was like 2 minutes, maybe max, but I was just like screaming, "Where is my baby?"
Mm-hmm.
It's such a traumatic event. I think people really, really underestimate that.
Oh,
To
huge,
recover.
huge. And so he, again, had no contact for 4 days with people. And I can't imagine what trauma that triggered in his body, but he's really been in a sympathetic, like, dominance for the first 2.5, 3 years of his life. And fortunately, we did some biofeedback that helped, but there's still a lot of things that I don't feel have integrated within him. And separation anxiety, massive, a lot of emotional up and down. And people can say, oh, that's just 3. It's like, no, your kid and you see the massive up and down.
Especially if you've had 5 more or 4 more.
Well, yeah, we have 4 others. So we kind of know what they've all been like. And he is the X factor. Now, do I believe he can do great things? Absolutely. And I think maybe he's even set up to do great things because of what he's already been able to overcome at the young age of almost 4 years old.
Yeah, sure.
And that's exciting to kind of think about. So to answer your question, yes, it impacts the kid. Does it mean that they're not going to do great things in life? No. They may have to overcome a lot more stuff because of what they're dealt. And as I've done body code and emotion code, and I see the generational stuff that comes up on people, I mean, we're talking 6, 7, 9, 10 generations back of, and even longer, right? I think the longest one I tested was like 26 generations back. And I forgot what it was. It was just a couple of years ago, but I'm like, wow, this has held on in your family for a long time. And the lady was like, you're telling me? She's like, yeah, we all have this history.
Yeah,
and she's like, that's crazy. So yeah, we pass energy, emotion, toxin onto the mom, specifically onto the fetus. And then those first moments, weeks, days, months, I mean, those are huge. And it's hard. There's one guy, I forgot what his name is. I think his last name is Bishop, but he wrote a book called How to Uneff Yourself. And then he also wrote one called Grow Up. And what I really appreciated that he said is that when we're born, we don't realize that we're born into an existing conversation.
I love that. We are born into an existing conversation.
Yeah.
Wow. That's
And that
awesome.
just like blew me away. I'm like, oh my gosh, what does it feel like to walk in on a conversation? You have no idea what's going on. You're kind of excluded from that, but you think
your poor soul, right? Like just your poor soul you walked into and you have no idea what you walked into. Yeah.
And it's not just the existing conversation between the couple. It's the existing conversation in your own stuff, right?
Yes, for sure.
And so kids think that we're supposed to know it all and like, oh, our parents know what to do until they figure out parents have no idea what they're doing. Right? What have they done to me? And I think that's why we hit 40 and we're like, dude, I got to figure a lot of stuff out. What's wrong with me? I didn't believe that was true until I did. So, but I think it can happen a lot younger, right? If we have the awareness and if parents kind of recognize that and work with their kids on things, and communicate and are open with that and accepting of what the kid's feeling, oh my gosh, that can change a family. That can change, like that can be the thing that changes the family forever going forwards. But to go back to that, this stuff massively impacts
For sure.
the kids. And then you think of what kids are inundated with now in terms of emotion, social media, scrolling, toxicity. I mean, such a toxic environment. And
Crazy. Yeah,
I mean, it's amazing that you know we still persist, which is fantastic. There's a lot to overcome with that,
for sure.
and I think that the harder we push, and maybe sometimes the more stubborn that
Hmm.
that person is, maybe the better, because it's like I'm not settling for what the answer is, and that person is going to do some amazing stuff. They may have a lot of bumps in the road, a lot of
For
challenges,
sure.
but
Yeah.
it's like, dude, they're going to do something incredible.
Yeah.
And I think people in this space have done that. Like no one is in this space because this would be a really cool thing to do, right? This would just be
Yeah.
a lot of fun to
I
work
think
with
people really
people.
forget that though. They'll look at you and they say, look at this 40 some guy. He's so fit. He's so healthy. He's never had any issues I had. They'll look at me and they say, she's never had any issues. That's why I
Right.
think it's important. Like I share my story on my website. I share my story on the social media. I show the pictures of me being overweight, and obviously you can't show the pictures of IBS, but it was just like, you could see it, how
Yeah.
trapped I was. It wasn't because I chose, it felt like this was the only option, and then once you're in, it's, welcome to the dark side kind of thing, and
Yeah.
you can't go back. Once the awareness
No.
is there, you can't unsee it, you can't unlearn, and, I mean, to me, it's like you have to persist. And, the reason that I say with the kids, because I had those 2 different experiences as well, like, it was so traumatic in the pregnancy, like, no appreciation the first time versus the second time where I was like, "I think I can do this better." Uh Not even that I think I can do this better, I just crave a different experience, and my connection with the 2 girls is so different, and there is a lot of sadness and, like, self-forgiveness that I still continue have to do because I didn't do the prep work for my first.
Um,
And so it is important to continue to practice that self-forgiveness because it's like if you would have known better, you would have done better, and that really helped me. So for anyone who's listening and you're starting to feel guilty for all the things that you didn't do, it's like just stop yourself right there and know that if you would have known better, you would have done better. But once you do know, it's time to, take it into your own hands.
and I think that, it's also, we live in a very masculine society. It's just
For sure.
how it is, right? And it's
Like
changing.
toxic masculinity.
And I wouldn't even say that. I would just say masculine in the sense of, you know, you
Yeah.
look at like in the past, men, like you're not sharing a whole lot, right? Not a lot of emotion, very passionate about things, but it's
Yeah.
like, you know what? Just get up. Like you're fine.
Totally.
Stop it. Stop crying. I'll give you something to cry about, whatever, all that kind of stuff. I heard all that. But I think with just this generation, it's definitely changing.
For
And
sure.
and I think that there is a component where we need to allow ourselves to feel. It's so like, and I think women especially are told, you're just emotional. It's like, well, okay, yeah, we are emotional beings. And when you deny that of even yourself, like that's stupid. I shouldn't feel that. Why am I feeling that way? That's so dumb. Stop crying. Well, why? Maybe
Totally.
you need to express that and need someone in your life that can just sit with you. Not that you want to wallow in that for like, time,
Yeah. For
but
sure.
there's a need to feel what we're feeling and to accept it, because if we keep resisting, man, it's just going to persist. And I don't think that the guilt is healthy, but we can look back and say, man, I was really struggling and I can accept that. Again, have an acceptance for it. It doesn't mean that and I think that's another, not just awareness, but like accept the world that you have created, right? You have part in it. It's your life. You've created this world around you, in you, through you. And I think really once that acceptance happens, then the ability to begin to love and take responsibility. And because without love, responsibility can be like, well, yeah, man, I'm the worst person in the world, so I'm going to punish myself. But when you
Yep.
add that love component to it and take responsibility, so now I can take responsibility in love, then we can grow. But I think that acceptance of, "Hey, this is what I created. This is what happened. This is what was. This is what is. Okay, and maybe have a good cry. Maybe a few cries. Maybe writing down like all the crap that you experience, and then just be like, wow, I have the opportunity now to create something new, to create something different, and that's hard because it looks different. Never done it.
For
First
sure.
question is
And maybe
how.
never seen it, never seen anybody do it
Right.
either, right?
And so I would just say the first question that you ask should not be how, because you don't know how. You could ask,
Who?
what do I want? And
Yeah.
why do I want it? And then if you really understand your what and why, the how is going to start to come. It's just going to show up and you'll start to walk into that light. And then more light opens up. And then you have, okay, what else? Why do I want that? And like that why becomes, I'll say bigger in
For
terms
sure.
of expansiveness, but it also becomes more focused and like I have laser light focus and this is how big this is. So there's so many layers to it and it's so fun and it's life. Like someone, I think maybe my wife and I were talking about this. No, it was her and she came to the realization, why would I expect to feel anything different? This is what I'm going through so that this vision that I have in my mind can actually happen. If I'm not going through this, I can't let go and see the person within that is then going to shine and be a light for this population of people that she would love to talk to. And that realization, oh my gosh, how freeing is that? But it's taken a long time to get to. And but that doesn't matter. It's where she needs to be now. And you know,
Having
that's
patience through
critical.
the process, having patience through the process. I actually had like an astrological reading on my birth chart, and I
Okay.
was fascinated how much information, like both my husband and I did it, and then we did it for our daughter as well, because we wanted to understand her more. We have a harder time connecting with her, and it was really insightful, but I was, like, just shocked of how much information he could tell about me or about my husband just by looking at the birth date, the location, the time that you were born, and how the stars and the moon and all the planets were aligned and what that means about you and your spiritual journey, and
That's
he
cool.
calls it was very cool. It's just like we have this spiritual curriculum. You don't have to fill it if you don't want to, but it is there. And
Yeah.
so here's some things that are showing up, and you can work on it towards it, and you're really set up for this in your life right now. So if you want to do that, you can. For example, for me, there was a lot of speaking and leadership that showed up. It's like, you should get on stages. I was like, fantastic. I already plan to do that. So it was incredible because he could just see it in the chart. And I'm like, this is so much more than what I think my little, in my basement, in my office, I'm here working away. It's like, there's so much bigger plan, and
Yeah.
it's hard to grasp it.
Yeah. And we don't and you don't have to grasp it all at once.
That's it.
Right? You just take it a little bit at a time. You can kind of see the
Mhm.
big picture, which can be a little scary sometimes.
For sure, yeah.
And I think that's good.
Intimidating.
I think
Yeah.
that's good to have a little bit of like uncertainty because we need resistance to work through. If it was just easy, it would be like we wouldn't value it. But when you have that little bit of resistance or sometimes a lot of resistance, and then you get to
Mhm.
that place or embrace more of that, it's like, dude, I'm so grateful for the journey. What an amazing like trip like
Sure.
that was. What's the next one? To get
What's the
ready.
next one? It's coming, yeah, it's
Yep.
coming. There's always a next one.
Yep.
Well, thanks so much, Dr. Randy, for sharing your knowledge and uh, your journey. It's wonderful. Where can people find you?
So they can find us on Instagram at Total Body Wellness Clinic, Facebook, the same. Our website is totalbodywellnessclinic.com. I have a podcast that you're going to be on in a couple weeks, Restore the Real. And then if people are interested, I have a Facebook group called Empower Act Heal that, we teach weekly in there, and that's just a great community. So those are the places that you can find me.
Amazing. Thank you. Anything that you feel that we maybe didn't cover or you would like to, a parting thought?
I think I would just say, remember that you are greater than what you think, right? I believe that there's divinity within each of us. Sometimes it's harder to see than others, and we doubt. However, in knowing that it's there and trusting in the process, trusting in like each of these little voyages that make up our journey in life, and seeing the good, seeing the love, seeing gratitude, I think those things are critical to really dive into that divinity and to be able to see the real person there. It's not about gaining. This is what I feel. I think this is what I've really come to know. It's not about what I need to get or gain. It's about what I need to let go so that, again, that essence shines.
Sure.
I think that's critical. So what do you need to let go to allow your essence and light to shine for yourself, your family, and others?
Yep. It's not so much about what you need to be doing. It's what you need to stop doing. Sometimes, right?
Sometimes, yeah.
That's right.
Yeah.
Thanks so much, Dr. Randy. I appreciate you.
You're welcome. Thanks for having me on. It was such an awesome conversation.
Thank you.
Okay. Blessings.